Philip, how are you doing today?
Oh, hey, I'm doing all right. How are you doing?
I'm doing good, thanks.
All right.
How's your knee feeling today?
It feels okay. There's not as much pain, but it's still kind of stiff. I can't move it as far as I want to. It just feels weak.
Okay, I hear you. And we're actually going to be teaching you an exercise today to help strengthen around your knee, so it'll help it to get some more range of motion and more strength.
Great.
And so the exercise we'll be teaching you today is called a short arc quad exercise. And you'll need to know why these are beneficial for your recovery process and how to properly perform them on your own. Have you ever done these before?
No, I've never even heard it before.
Okay, great. But by the end of our session today, you'll be able to do 3 sets of 10 of these on your own with your affected knee without my intervention.
Okay.
Does that sound good?
Sounds great to me.
Okay. I'm just going to tell you a little more about them. You need to know how to do these because it is a strengthening exercise you'll be able to do at our clinic and at home in order to strengthen your quadriceps muscle. And this muscle is on the front of your thigh and helps control your knee. And your right quadriceps on your post-ACL knee is currently a little weak, and we want to work to strengthen around it and increase its endurance so that your knee regains more stability and range of motion.
Okay.
So that you can more fully extend your knee. So I know you're having a little trouble with that.
Yeah.
Okay. This exercise is fairly similar, if you can imagine this, to laying on your back and kicking a soccer ball in slow motion.
Okay. Okay.
And as you keep on doing these exercises, we can adjust it to give you more repetitions and sets in order to increase your strength and endurance even more.
Okay.
Do you have any questions for me about that?
No, I can't think of any.
Okay. Can you tell me in your own words why it's important to learn how to do these?
Well, it's important to learn the short arc quad because it's going to help strengthen my quadriceps muscle, and that's right here, in the front of my leg here. So it's going to help me, regain that strength and just increase my range of motion. And it's kind of like laying on my back, kicking a soccer ball. So I'm pretty excited to learn these.
Okay, awesome. So I'm going to show you how to do these, and then we'll have you do it, okay?
All right, let's do it.
All right, let's do it. Okay, so first I'm going to explain how to do the exercise verbally, and then I'll show you how to do it.
Okay.
So to do short arc quads, you're going to take a towel roll, and at home, you just get 2 large bath towels and roll it to that thickness.
Okay.
And you're going to lay on a flat surface, and then you're going to put the towel roll under your right knee, and you're going to strengthen that quadriceps muscle we were talking about to raise your leg, and then you're going to hold it for 5 seconds and bring it back down. And then you'll repeat that 9 more times to do 10 repetitions. And then you take a minute or 2 of rest, and then you do another 10 repetitions, and then you repeat that again to do another 10 repetitions.
Okay.
So in all, it's 3 sets of 10. Does that make sense?
Yeah, 3 sets of 10. Okay.
Okay, so now I'm going to show you how to do it. So you take the towel roll, and put it under your right knee there, you're having trouble with. And you're going to lay back, and then you're going to tighten this muscle here, and raise your leg up, 2, 3, 4, 5, and slowly and controlled back down. You can do that 9 more times, 2, 3, 4, 5, and back down until you have 10. And then you take a couple minutes of rest, a minute or 2. Just be breathing the whole time. And then you're going to do 10 more of those, 2, 3, 4, 5, and back down until you have the 3 sets of 10. Does that make sense?
Okay, that makes sense. Yeah.
Okay. So I'll hop on off and I'll have you get on the table and try to show me how to do that.
Okay.
Before you do it, can you explain to me verbally how you go about doing this?
Okay, yeah, so I just want to take like 2 bath towels and just roll them up like this, and then just put it just right behind my knee, and then I just lay back, and then I just contract this muscle right here, and then just bring my leg up and just hold it for 5 seconds, you said? And then I do 10 reps for 3 sets, right? So I would do 10, and then I would take a break for a little while, then I come back and I do the next set. And I'll keep doing that.
Okay.
All right.
So show me how you do it.
Okay. Just contract it like that, and then just hold for 5 seconds.
Yeah, that looks good. And make sure that if you want to make sure you're doing it right, you can put your hand over that muscle there and feel it, tightening up. Because that's the one we want to work. So.
Okay, yeah, I can definitely feel that contraction there.
Okay. looks good. Make sure you have your leg needles in there.
Okay.
Does that feel good, or?
Oh yeah, it
Doesn't
feels
hurt?
good. No pain at all, no.
Okay, great. So do you think we can have you do a full 3 sets of 10 without me cueing you or telling you what to do?
I can do that.
Okay, let's see you do it.
All right. Oh yeah, I'm starting to feel that.
Good.
That was the first set. Whew. Now, how long should I wait in between sets?
Just,
Like a minute or so?
just start breathing, maybe just like a good minute, make
Okay.
sure you just feel ready to go again.
Okay.
Doing a good job.
All right, one more set. One more.
A little breather.
The last one. Ooh, all right.
Okay, excellent.
Ooh, boy. All right. I'm tired.
Okay, so the reason, we had you do all this today, the real reason is that, doing these exercises like this one will help you with things that you do every day. So, for example, just, walking around, it'll help strengthen your legs so that you're less fatigued, you can get around easier. And then that quadriceps muscle that we were working on, it also helps you, stabilize your knee. And, for example, doing things like going down the stairs, it'll help it so that your knee doesn't, buckle and give in. It'll kind of help to slowly extend your knee.
Okay.
Does that make sense?
It does, yes.
So can you repeat to me how this will carry over into your daily life, this activity?
Yeah, so it's going to help me kind of in my everyday life, really, going down steps, just helping that knee, just be stable. It won't buckle on me. And just kind of like walking around and just things like that. Just things I need to do every day.
Yeah, very good. So just to make sure you have this right, can you tell me the exercise you learned today and why it's important?
Okay, so today I learned how to do the short arc quad, and that helps strengthen my quadricep muscle. So that's gonna, give me that strength back, and I'll be able to, move my knee and my leg like I used to be. So yeah, it's pretty important.
Okay. And you feel confident that you can do that exercise at home without any help?
Oh yeah, I can definitely. I do feel confident that I can do this at home by myself with no help.
Okay. Excellent.
Hey Amanda, how are you doing today?
I'm good. How are you?
Good. How's your knee feeling?
It's all right. It's a little weak, but it's doing better.
Yeah. Well, that's good. So today I'm going to teach you a hip abduction exercise, and that's working to help stabilize your knee. Since your surgery, all the muscles in that right leg have gotten weak. So we're just trying to build them back up to the strength that they had prior to the surgery. So this hip abduction exercise is performed in side lying, and by the end of today, I want you to be able to perform this exercise competently and be able to do it at home on your own. In addition, I want you to be able to explain to anyone who asks why this exercise is important. So can you tell me what I want you to be able to do by the end of today's session and why this exercise is important?
Yeah, you're going to be teaching me how to do a hip abduction exercise, and I'm going to learn it so I can do it competently on my own at home. And it's important because it helps strengthen my hip abductor muscles, which are important for activities like walking and jumping, running, everyday things too.
Great. So now I'm going to demonstrate the exercise for you, and then I'll let you try it.
Okay.
All right, Amanda. So I'm going to demonstrate the sideline hip abduction exercise for you and kind of walk you through it, and then I'm going to let you try it. So first I need you obviously lying on your side. You're going to use your left leg, keeping your knee bent to help stabilize you. Your hips need to be staying on top of each other, and be sure to not bring your leg forward or backwards when you're lifting this leg up, and that's going to be sure to engage this side of your leg, your hip abductors, okay? So what you're going to do, you can place your hand here, and that can kind of give you a cue as to whether your hips are rolling back or forward, trying to keep them in line with each other. And then I want you to lift your leg up and back down. Again, being sure that your leg doesn't go forward or backwards throughout the motion, and going nice and slow and controlled, bringing it up and back down. Do you have any questions for me?
I don't think so. I think I can do that.
Okay. Well, let's see you give it a try.
Okay. So I'm going to lay my side, and bend my left knee, and then my right will come out straight, and put a hand on my
So
hip.
go ahead and bring your hips. There you go. Now they're on top of each other.
Okay. And then I slowly raise and lower.
Excellent.
2, 3.
Good. And that looks good. You're not bringing your leg forward or backwards.
Okay.
Just making sure that your hips are staying on top of each other.
Okay.
One thing you could do at home, if you could do this against a wall and have a wall along your back, that'll help you know that your hips are on top of each other and that your legs, if your legs staying in contact with the wall, that you're going in a straight plane.
That makes sense.
Okay. So, do you think you could do this on your own?
Yes.
All right, so let's see you do this 3 sets of 10, and when you're at home, I want you to do this twice a day.
Okay. 3 sets of 10 now?
Mm-hmm.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so that was 1 set.
That looks great. How does it feel?
It feels good. Yeah.
Good.
Definitely working that side there, like you
Yeah.
were saying. Okay, so I waited, and now I'm going to do a second set. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. So wait a little bit. It's definitely working the muscles. I can feel it now.
That's good.
So I think we're going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Excellent. That looks good.
Great.
All right, really good. How did it feel?
It was a little harder by the end than I thought it would be, but I can definitely feel it working the side of my leg like you were saying. So.
Good. So I just want to recap what we learned today, why it's important, and what exactly you're going to be doing at home.
Okay. So you taught me how to do the side-lying hip abduction today, and I'll be doing that 2 times a day at home, and I'll be doing 3 sets of 10. And it's important because it's strengthening the side of my thigh, which will help stabilize my knee, and it'll help me with doing things every day, like running and walking and jumping, all that.
Great. So what were a couple cues that I gave you to make sure that you're performing this exercise properly?
Make sure I'm lying on my side with my left knee flexed, and to make sure that my leg was straight up from my body, and to make sure my hips were stacked together correctly. I can put my hand on my hip to help, get that in line.
Great. It sounds like you've got it down. Do you have any other questions for me?
No, I think that's it.
All right, great. I'll see you next time.
Okay, sounds good.
Hi Becky, how are you doing today?
Good. How are you, Alex?
Good. How's your knee feeling?
It's getting better. It's still stiff. I still feel weak. But it's getting better.
I understand. After ACL surgery and reconstruction, it can be pretty stiff, and I'm sure the pain was pretty bad too.
Yeah, it's getting better. But
Good. Well, today I wanted to teach you a home exercise called straight leg raises. Have you heard of them before?
I have.
Okay, cool. So you're already like a leg up, so to speak. Straight leg raises are going to help you to strengthen your quadriceps muscle, which is the upper thigh.
Mm-hmm.
And when you strengthen that, it can support the knee. So throughout your day, when you're walking, going up and down stairs, maybe running in the future, then you'll have that strength. And it's also good to just help push any inflammation out when you contract your muscles like that.
Mm-hmm.
So that's what we're going to work on today. Would you mind repeating back to me what the benefits of this exercise are?
Mm-hmm. So I'm going to learn how to do the straight leg raise exercise, and that's going to help strengthen my quadriceps muscle, which is going to help, one, push all the inflammation out of my knee, as well as give my knee some stability when I'm walking or maybe running or going up and down stairs.
Yeah, absolutely. So let's get to it. I'll show you how to do the exercise. Great. Okay, Becky, I'm going to show you how to do straight leg raises. I want to walk you through it first, and then I'll have you watch me do it, and then you'll do it on your own.
Okay.
So I'm going to start with my injured leg out straight and my unaffected leg bent, and this is going to be helping me support. You're going to prop up on your elbows, and I want you to have your toes pointing up to the sky, and you want to engage your quadriceps so it's active. Once that's happening, you're going to lift your leg up to in line with your bent knee, hold for 2 seconds, and then slowly lower it back down. You're going to do this 5 times, 3 sets, so 3 sets of 5, holding for 2 seconds and then lowering it back down. And then after that whole set, you can wait a minute and then do it again.
Okay.
All right, so I'm going to show you. I'm going to prop up on my elbows, and then with my toes pointing straight up to the sky, my quadricep as active as I can get it. I'm going to lift my leg up in line with my knee, and then slowly lower it back down. If that's too high, you can extend this leg a little bit for a little more ease, depending on how tight you are. 2, and lower down.
Okay.
Lift up, 1, 2, and lower down. Okay. So does that make sense?
I think so.
All right, I'm going to have you try now.
Okay.
Okay. So, and just be sure you walk me through it while you're doing it.
Okay. So I'm going to do the straight leg raise, and I'm going to start by putting my unaffected leg in a bent position, which is going to help stabilize me. I'm going to go on my elbows, and first I'm going to engage my quadriceps muscle, and just lift my leg up
Good job.
and hold it and back down.
And try not to let your toes point out. Just keep them pointing straight
Okay.
up to the sky. Good.
Okay, so keeping my toes pointing straight, lift up, hold for
2.
Back down. Very good. All right, so I'm going to have you do that 5 times for 3 sets.
Okay.
All right? And just please count out loud when you're holding the 2.
Okay.
So we know where we are.
So 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. So that's 5. So I'm going to take a 1-minute break before I do the next set of 5.
Correct. How did that feel? Did you have any pain?
No, it felt good.
Good.
It was a little harder than I expected, but hopefully I'll get stronger.
Absolutely. All right, so let's do it again.
1, 2. 1, 2. 1, 2. 1, 2. 1, 2.
Very good. So just relax. Don't forget to breathe throughout the exercise. It helps. It makes it easier. Okay. All right, let's do that final set.
1, 2. 1, 2. 1, 2. 1, 2. 1, 2.
Very good. All right. You did it really well. Do you think you can do this at home on your own?
Yeah, I think I could do 3 sets of 5, holding for 2 seconds at the top on my own.
And we're going to do it 3 times a day.
Okay, 3
Just
times
to
a day.
Build up that strength. All right. Well, I'm going to have you, we'll just take a seat and then we'll go over a few more things.
Okay.
All right, Becky, you did the straight leg races today really well. I just want to go over what you think all the benefits are, how to do the exercise, and how many times a day. So how do you feel like this will benefit your daily life?
So the straight leg raise exercise is going to help strengthen my quadriceps, which is going to give me stability in my knee. And that's going to help me during walking, going up and down stairs, and maybe running in my future. It's also going to help reduce some of the inflammation in my knee.
Great. And how do you perform the exercise?
So I'm going to do it with my legs straight. I'm going to bend my unaffected leg for stability. I'm going to raise my affected leg straight, engaging my quadriceps to the level of my unaffected knee. Hold it for 2 seconds. And I'm going to do 3 sets of 5 and 3 times a day.
Yes, exactly. And do you have any other questions for me?
I don't think so.
All right. Well, then I will see you next week.
Great.
All right.
Philip, how you doing today?
Hey Ryan, how's it going?
Pretty good.
Good.
How's your knee?
It's alright. It's getting a little better. There's still some swelling. It's kind of painful. It's a little sore.
Mm-hmm. All right, yeah, I can see the swelling there. So what we're actually going to do today is a treatment to address that swelling, as well as the pain. It's going to be an ice massage, and I want to teach you how to do it, okay? And then I want you to be able to perform it at your house a couple times a day. This is going to help with the swelling and the pain. So before we begin, though, I just want to make sure that you don't have any sensation, dysfunction or disorders. So have you had any past medical history of cold urticaria?
No, I have not.
All right, how about paroxysmal cold hemoglobinemia?
No, I don't think so.
Okay, what about Raynaud's disease? All right,
I don't know.
nothing? Okay, good. And then next, I actually want to test your sensation on your skin.
Okay.
So I've got 2 spoons here. Okay, one of them is a little warm, the other one's cold, and I'm just going to tap them. Here's the hot one here. Okay, and this is cold.
Oh, okay.
All right, and I'm going to put them on your knee here where I'm going to be putting the ice massage, and I want you to just tell me which one's cold or hot. All right?
Okay, I'll go ahead and close my eyes.
Yeah, and close your eyes.
That's cold. Hot. Hot.
so I just want to explain to you first why we're going to do this, and I'd like for you to be able to explain that back to me. So you're in the inflammatory stage of healing, so that's going to be characterized by a lot of swelling. And we're going to try and modulate that swelling with the ice. That's what the ice does. So it does this by kind of constricting your blood vessels in that area, so it doesn't allow a lot of blood flow. And that's going to reduce the swelling. And then also it's going to help with the pain because it's going to slow down nerve conduction, so kind of your knee telling your brain that you've got pain. It's going to slow that down, and it's going to help with that a little bit.
Okay.
So if you could just summarize really quickly why.
Okay, so you said I'm kind of in the end of the acute inflammatory stage of healing. So we want to use the ice to kind of cut down on the swelling. It's gonna constrict the blood flow, so not as much blood is gonna get down there to the swelling, and it's gonna help with the pain because it's gonna slow down like nerve conduction. You said?
Yeah.
Yeah. So
exactly.
it's gonna slow the signals down up to my brain, so the pain will decrease.
Exactly. Yep. Okay. So let me show you how you're gonna do it.
Okay.
I'll do it on myself first, and then I'll have you show me how to do it. I'm not wearing the perfect clothes for this, but that's alright. Okay, so.
I like your socks.
Oh, thanks. Okay, so you're just gonna have your knee here. Okay, just freeze a little Dixie cup like this. I filled it with water, ice, and then you peel the bottom off. So you want to expose the ice directly on your skin.
Okay.
That's peeled off, good enough. Alright, so yeah, you see the ice is completely exposed on here, right?
Yes.
Alright, so now what you're going to do is just right on the bottom of your knee here, kind of under your kneecap, you just go in small, kind of circular motions, just like this.
Okay.
Alright, and what's that do? That's just going to cool off that one spot right there. You don't want to get too far from the spot, like right under your knee here. And what you want to make sure is you do the small, kind of circular movements.
Okay.
Alright? And you're going to go through kind of a series of sensations on your knee there. The first, it's just going to be cool when you put the ice on there, and then it's going to be pretty cold. After that, it's going to burn a little bit, be a little tingly, a little burning, and then it'll just be numb. And the numbing is what you want. And after it gets numb, you want to continue doing it. So again, it's just going to be just small circles after it's numb for 5 minutes.
Okay.
And you can just do this, 3 or 4 times a day. And another thing to remember, you probably just want to have, something propped underneath your leg just like this, and then a towel because this will start to drip. So if you want to wipe it off just like that.
Okay.
All right?
That sounds good.
All right, so it's your turn now.
Okay.
Before you do it, I just want you to kind of explain to me the process that you're going to do.
Okay, so I'm gonna get the little Dixie cup, fill it with water, freeze it, and then peel off the bottom, and then I'm just gonna kind of apply it to my knee, and that's gonna help with the swelling and the pain. And then I also want to apply it, like you said, 4 times a day. I'm gonna go through a couple different sensations. So first it'll be cool, then cold. I think it said burning. Was it burning? And then okay, a little burning, and then it'll be numb. And then once it gets numb, I want to keep going for 5 minutes after that?
Yep.
5 minutes?
Exactly.
Okay. Alright, so I think that's everything
Good.
said.
All right, so you can go ahead and grab it and then just show me how you do the motion underneath it.
Okay, just peel a little bit of that off.
Yeah, make sure the ice is.
Fully exposed.
Mhm.
There we go. It's fully exposed, I think, now. Okay.
Yep.
I just want to just like that.
All right. Well, you want to make sure you do kind of, instead of going down like this, just circles. Kind of
Oh,
circular right
okay.
down.
Okay.
And you don't want to stray too far from the spot, kind of right under your knee, underneath your kneecap.
Okay, so we go just like that?
Yep, just like that. That's good.
Okay. It's kind of cool. It's not
Getting cold.
not
And
that
then
bad. It's just,
if you just have the towel here in your other hand, you can wipe off, if it starts to drip down your leg and stuff like that.
okay.
How does it feel?
Oh yeah, it's starting to get cold now.
Yeah, it shouldn't take too long to kind of go through the stages there, and it might get a little red, but that's just part of the cold on there after it gets numb.
Okay.
All right, so Philip, now I just want you to run through this like you would do it at your house by yourself.
Okay. All right. Circular motions there. It's kind of cool.
Okay.
Oh man, that's cold actually. cold. It's actually starting to burn a little bit now, actually. Yeah, there's that number that you were talking about right there.
Good.
And then I just keep going for 5 minutes after that. Okay.
Yep, that's correct. All right, so Philip, after that, I just want you to explain to me kind of what you learned today and the process that you're going to do with the ice massage and everything.
Okay, so today I learned how to do the ice massage, and you want me to do it 4 times a day. And basically, I'll just get a little Dixie cup, fill it up with the ice, and then I go in circular motions right there below the kneecap, and then I'm gonna feel 4 sensations. So first it's gonna be cool, then cold, burning, then numb, and then when it's numb, that's when I keep going for 5 more minutes.
Exactly.
And then all this is supposed to help decrease the swelling and the pain in my knee.
Exactly. That is correct. Do you have any other questions or anything?
I think that's it. It feels a little better though. So.
All right. Perfect.
All right.
It's nice seeing you today.
Nice seeing you as well. Hey Ryan, how's it going?
Hey, how you doing today?
I'm doing alright. How about yourself?
Pretty good. Pretty good.
How's the knee feeling?
It's all right. It's a little stiff, you know.
Okay. Well, 2 weeks out from surgery, that is to be expected. So today, what I want to do is I'm going to show you an exercise that's going to help give you some of that range of motion back. Okay. Now, this is going to be an exercise that you can do here at the clinic and as well as at home. Okay. So by the end of today, I want you to be able to safely perform this at home by yourself, no supervision. Okay.
All right.
All right. So the name of this exercise I like to call it mini squats.
Mini squats.
So it's kind of like a squat, but just a small squat. So basically, what you're going to do is you're going to stand up with your back against the wall. All right. Kind of, with your feet out in front of you, with your weight on your heels.
Okay.
I want you to just kind of slide your back down the wall a little bit. And I want you to stop when you get about a quarter of the way down. Okay. So we don't want to go too far. We don't want to push it too much. Okay. Now, if there's any pain with this exercise, I want you to stop immediately and let me know.
Okay.
Okay. So like I said, back straight against the wall. You're gonna bend down a little bit, just about a quarter of the way down, with your weight, over your weight in your heels. Okay. So this stretch or this exercise, excuse me, it's gonna help increase some of that range of motion, and it's gonna be really important for just kind of activities throughout your daily life.
Okay.
So sitting in a chair, getting out of a chair, getting in your car, getting out of your car, going to the bathroom.
Oh,
So it's gonna help you just do a whole wide range of things.
okay.
All right, that sound good?
Sounds good to me.
Okay, so if you could just repeat back to me just some of the things that about the exercise and why it's important for you to learn how to do this.
So it's important because it's going to help me kind of with daily activities. It's going to increase my range of motion.
Okay.
So things like sitting down or getting up, getting in and out of the car, and going to the bathroom. And it's going to increase my range of motion with that. And then for the exercise, did you want me to explain how to do that now too?
Yeah, go ahead and explain.
Yeah. So I go up against a wall. I bend down just about a quarter of the way down, you said?
Mm-hmm.
And I want to have my weight kind of shifted towards my heels and just go down as far as I can go, well, like a quarter of the way,
Yeah.
but with no pain.
Yes, no pain, no pain.
Okay.
All right, sounds like you understand. So I'm going to go ahead and I'm going to demonstrate for you, and then I want you to do it after me.
Okay.
So, like I said before, just want to come over, to a wall, just make sure, nothing's in the way. And what you want to do is just kind of have your feet out in front of you, like I said, and then back straight, and then you just want to just come on down about a quarter of the way. Just make sure those knees don't come out in front of those toes, okay?
All right.
That's really important. So you kind of just kind of squat down a little bit, no pain, and come back up.
Okay.
Okay? So just
Squat down, and back up. And you said the feet are shoulder width apart?
yes, shoulder width apart.
Okay.
Just come on down, and then back up. Now I want you to do, when you do these, I want you to do 2 sets of 10.
2 sets of 10?
Okay? With no pain.
Okay.
All right. So you want to give it a shot for me?
Sure. All right. So put my feet like shoulder width apart.
There you go.
And then I want to kind of be back on my heels a little bit and just squat down about a quarter of the way and no pain, and then go back up. And you said 2 sets of 10?
Yes.
Okay.
Yep. And just make sure those knees don't
Oh,
come
yeah.
out in front of those toes.
So I don't want my knees to come out from my toes. That good?
That's good, just like that. Now, do you feel comfortable doing that?
I do, yep.
All right, and there's no pain, right?
No pain at all.
Okay, so I want you to go ahead and just act like you're at your home on a regular Saturday. Just go ahead and give me 2 sets of 10.
Okay. So back up against the wall. Feet shoulder width apart. I don't want my knees to pass my toes. 1, 2, 3, 4, 5,
Looking good, looking good.
6, 7, 8, 9, 10.
Okay, you go ahead and just rest and shake it out a little bit, you know.
And then just 2, and then another set of 10.
Just one more set of 10, yep.
Two, 3, 4, 5, 6, 7, 8, 9, 10.
All right, great job, great job. Go ahead and have another seat. Okay, and now, as we progress and as you gain more range of motion, we can increase the sets. So you can take it from 2, you can go up to 3. But also we can increase the depth, so you can actually start going down a little further.
Okay.
As that range of motion gets better and as your pain level decreases. Okay, so I just want to go a quick review over everything we went over today, like why you want to do this exercise, how it's going to help you in your daily life. So if you could just repeat back to me, just what you remember.
Sure. So I want to do it to help with the range of motion in my knee, and it's going to help with things like getting out of my car, getting in my car, just sitting up and sitting down in general, and also going to the bathroom. I'm going to start with 2 sets of 10 every day, and I just go up against the wall. I want to make sure my knees don't come out past my toes when I do it, and my feet are shoulder width apart. And then I go down about 1/4 of the way. And as it gets easier, I can go down farther, or you said I can add another set of 10, right?
That's correct, that's correct. All right, well, it sounds like you got a good understanding of what's going on. So do you have any questions for me?
I think that's it, no.
All right, well, I enjoyed it today, and just see Sally on the way out.
All right, excellent.
Have a good one.
You too, thank you.